Hi there, I'm Andrew Buller, sport therapist from Barnstaple, North Devon. Hopefully you're warm, and then we can go on to this next exercise, Lumbar-Thoracic Lateral Stoops. This will help with the correction of musculoskeletal disorders like scoliosis, and it's all helpful with the movement patterns to help correct this issue. First position, belly button zipped up as always, slight curvature of the lumbar spine, neutral position, lifted pelvic floor, palms together. Palms come up, out wide, and then retract and depress the shoulder blades. Now my hands are in a perfectly neutral position. They're not higher or lower. They're directly in line with my shoulder and chest line. I'm not going to move my hands now up or down. They're going to stay perfectly in line like a spirit level. In through nose, out through mouth. My hips have stayed in the same position. My hands have stayed in the same position. My spine has moved. Lumbar to thoracic moved laterally to my right as you view your left. In through nose, out through mouth. If you have scoliosis, this would be very difficult, but really encouraging to give it a go and persevere because it is beneficial. Development from this, in through nose, and a stoop, and then a rotation, and then a slight rotation the other way, but I'm still keeping my hands in the perfect position. So we're opening out the facet joints of our lumbar to thoracic spinal column. In through nose, out through mouth, stoop into the other side, a rotation, and then a rear rotation, keeping stooped over, back to the central location, and then come back to the center. Stoop, rotate, still stooped over, stoop to the other side, rotate, and increase your stoop and your rotation as you increase your strength and flexibility of your spinal column. Again, this posterior angle, I've taken my top off to show you the position of my spinal column between my lower lumbar and my thoracic region of the stoop. Hands together, out and retract, perfect scapular setting, cores engaged, slight curvature, lifted pelvic floor, belly button zipped up, and then I'm ready for the stoop. And then a rotation, and a rotation, always stooped over, stoop to the other side, hips stay still, all about the spinal movement, and a rotation, still stoop, rotation, and then back to the center and repeat.